Hello everyone, this is Mark LaBarbera. I'm going to be doing this quick memorization tricks for uh, 4th semester nursing exam 2, which will cover kidneys, liver, and fluid and electrolytes. Um, this may or may not be applicable to you. These are some memorization tricks that I find useful. You may or may not find them useful. If you do, I encourage you to use them, share them. If you're teaching other people, let them know some of these tricks that might help them too. In no particular order, serum ammonia, normal range is 15 to 45. So the way I remember it is in World War I, ammonia gas was ideal for trench warfare because when it became laden with moisture, the ammonia would sink down into the trenches. So on the clock face to the right, you see this kind of ammonia at the bottom of this clock face, and it's right up to the level of between 15 and 45 seconds. Sevelamer, or Renagel, is to be taken with food, maybe toast. So we have this kind of Renagel jelly, and I bet you're salivating now looking at this beautiful toast with the jelly on it. And it's being heated by a match. Matches contain phosphorus. This is a phosphate binder. Sodium polystyrene sulfonate, or KXlate. We abbreviate it SPS, which may also stand for Sun Potassium South or Suck Potassium South. I have the sodium polystyrene sulfonate in a styrofoam cup. Give us PO. You can give it PR, NG tube, which is basically PO down a tube. You must have bowel sounds to give this. And get ready for diarrhea and then fluid replacement. Prothrombin time, PT. I think of Army PT, physical training, and the standards for Army PT. You should be able to complete a 2-mile circuit running in about 12 to 15 minutes. The normal PT range is 12 to 15 seconds. Activated thromboplastin time, or PTT. The last T in this is time. So you look at the clock face at the right, and I've marked 24 and 36 in that wedge at the bottom in blue. Remember this guy? This is the Myosin mouse. Myosin sounds kind of like mouse. The myosin antibiotics are nephrotoxic and ototoxic. So remember this picture if you've never seen it before. Hyperkalemia. One of the things you'll classically see on EKG is these kind of peaked T waves. And this is just a picture of the big peaked T wave pushing the K pushing this big T wave up. Potassium rates. Remember the 10, 20, 40 rule. 10 milligrams peripheral IV, 20 milligrams central IV, which includes a PICC line, and 40 milligrams PO are the limits. INR normal range is 1 to 1.4. A therapeutic range is 2 to 3. Remember that if you remember 1, and then count 1 through 4, look at the graphic on the right, you have 1.4, and the point has the 2 and 3 in it. So 1, 2, 3, and 4. So we have 1 to 1.4 is normal, and 2 to 3 is a therapeutic range. Things that something in common with albumin, potassium, and RBCs, they all have a range of 3.5 to 5. See, it's easy as APC, or albumin, potassium, and RBCs. Patient's weight equals fluid weight. This is an easy way to measure fluid. uh, uh, on a patient. A UAP can measure this, and the graphic shows 1 gallon equals 3.4 pounds of water, which is about the size of a large baby. Biliary atresia. This is you take the biliary, which is the bile system. A is without, and tree, as in biliary tree. The definition is a blockage of the biliary tree causing a backup of bile. If not corrected, this can lead to liver failure. This is seen in infants around 2 to 8 weeks old, and there is a surgery to correct it, although it's temporary, and ultimately these infants need an eventual liver transplant. If you like this presentation, please share it, just not on the MCC Nursing Facebook page, because I wasn't real careful with all the images on here. Please join the Medical Education Depot if you like this. It's a page that I put on Facebook, and I've been sharing medical education on it. You can also subscribe to my YouTube site, Paramedic Sid 1, on the YouTube, and it has some videos like this, some other instructional videos on various things, some family videos, but I'll probably be putting more videos like this up. Let me know what you think. Hopefully I'll be doing more of these, and thank you for watching.